Healthcare systems across Canada are starting the new year much in the same way they ended 2023, under tremendous strain from an influx of patients, with doctors and nurses demanding support and solutions. Emergency rooms in many hospitals are filling up at an alarming rate, and in some cases operating over capacity for days on end. A surge of patients is being driven by the spread of respiratory illnesses like COVID-19, RSV, and the flu. A situation made even more difficult to navigate by acute staffing shortages at many hospitals. Albert Delatella is on this story for us. He joins us now. So Albert, good morning. Give us a sense of how bad Canada's healthcare strain is right now.
Good morning, Hillary. As you say, those respiratory illnesses and COVID really adding to the strain, and on top of the staffing shortages, they really create a challenging situation for hospitals across the country. And we do have some numbers to show you out of Quebec that just shows how that province is experiencing this. The occupancy rate there in their emergency rooms as of today sits at 135%. So that is the highest yet this season, and it's well above, of course, what would be considered full. If you look at the rates over the past 7 days, over the past week, you can see them inching up from 111% on December 27th, going from bad to worse, really, across that week. One Montreal nurse, he says this is the worst the healthcare system there has ever seen, and that it's really due to a perfect storm of staff shortages, respiratory illnesses, and, of course, COVID. Here's more from him.
COVID is rampant throughout the hospitals, throughout every unit, from the emergency room to psychiatry and to internal medicine and surgery. So we're seeing COVID, we're seeing RSV, we're seeing the flu. That's normal for this time of year. Basically, it's our reality now. The question is, how do we alleviate the pressures in the hospital? And what we're seeing right now, personally, from the government, what I've seen is not many answers. And we're seeing ER doctors right now complaining about the fact that there are no solutions and the government is not listening to their complaints.
And of course, it's not just Quebec experiencing this. In New Brunswick, staffing shortages, high numbers of patients, a lack of beds. That's what is being blamed for hospitals. They're issuing advisories and even closing some departments in recent days. And in Ontario, we're getting some numbers today from a survey that was done on behalf of CUPE's Ontario Council of Hospital Unions. That survey found that 41% of Ontario hospital workers dread going to work, and it also found that a similar number are considering leaving their jobs. So some concerning numbers there, and we are expecting to hear more from CUPE on that later today.
So, Albert, what can people do to ensure that they don't unnecessarily put even more burden on their community's healthcare system?
Yeah, so back to Quebec, that province is asking people if they have milder symptoms to consider going to different outlets than they might normally, so perhaps a pharmacy instead of their emergency room. And we spoke, actually, CBC News Network, you spoke with a respirologist, Dr. Samir Gupta, just a bit ago, and he said that really that helps not only prevent illness, but also prevent strain on ERs.
You know, people don't have a resource. A lot of people don't have a family doc, and that's a big part of the reason that people have to run to Emerge, because they just don't know when they're sick enough. If you feel a way you've never felt, is what I tell my patients. If you feel as so sick that you've never felt this way before, go to Emerge. If you have certain warning signs like chest pain, shortness of breath, if your loved one is behaving differently, they're confused, they've had loss of consciousness, these are things that should prompt a visit to the emergency room as well.
And seasonal vaccines, of course, factoring into all of this, both the flu vaccine and the COVID shot. Health experts say they really do make a big difference here. And with that in mind, perhaps adding some concern to that, only about 15% of people across the country are estimated to have received their COVID shot this season. Hillary.
Okay. Albert, thank you for this.
You're welcome.